What we did, we had a patient who was around a 60-year-old male. Elderly females are considered to have low kidney functions. They are not considered fit for the surgery, fit for the anesthesia. We did a very good workup of the donor, and after we found that the donor is stable, he has got good health functions.
Were there any challenges during the operation or surgery?
Yes, yes. See, the ideal donor is 65 year of age. So we did the surgery, donor surgery with the laparoscopic. We harvested the kidney and then we transplanted this kidney to his son. 65-year age is the maximum limit where we can have a donor, kidney donor.
तो हमारे साथ यहाँ पर एक और इंडिया बुक ऑफ रिकॉर्ड्स अचीवर्स जो हैं वो मौजूद हैं एज अ टीम उनकी तरफ से रिकॉर्ड कायम किया गया है और इंडिया बुक ऑफ रिकॉर्ड्स में उनका नाम दर्ज हुआ है। सबसे पहले मैं आप दोनों के बारे में जानना चाहूँगी।
मैं डॉक्टर विजय कुमार सिन्हा, आई एम ए ट्रांसप्लांट फिजिशियन।
You are a
ट्रांसप्लांट फिजिशियन।
transplant.
मैं डॉक्टर अमित कुमार देवड़ा, आई एम ए ट्रांसप्लांट सर्जन.
You are a surgeon and you are a physician. Okay, very nice, sir.
We work at Max Super Specialty Hospital, Noida, and this was formerly known as JP Hospital when this transplant surgery was done.
Okay. So you are continually practicing
Yeah, we are continually practicing in the same organization.
in the same organization.
Yeah.
Okay. So can you share something about what is your record?
See, what we did, we had a patient who was around a 60-year-old male whose mother came for a kidney transplant donor. So normally these patients are not taken as a donor because elderly females are considered to have low kidney functions. They are not considered fit for the surgery, fit for the anesthesia. So that was a challenge because they did not had any other donor in the family. Most of the other members had some other kidney problems or some other general health issues. So in this patient, because they were requesting that we do not have any other donor, we look at the literature and we found that hardly anybody has done any kind of transplant from an 80-year-old female, taking her as a donor. So we worked up her. We took guidance from the literature which were published about 70 years, 75 years of old age donor. And from there, we did a very good workup of the donor. And after we found that the donor is stable, he has got good health functions, and the kidney functions are good. We worked together as a team and sir operated on her, and we took out the kidney. We transplanted the kidney into her son, and after the transplant, the patient did very well, and that basically gives us an insight that even patients who are at the elderly or who are very much into that age, they can be considered as a donor. Normally, we should not read the book by the front page. We should understand what is going to happen if we take such kind of donors. And that has basically gone into now the society that even the elderly can be accepted as a kidney donor if they are healthy. So that is a message that we want to give to the society, that don't treat age just as a number. Look at the entire function, understand the basic things, the physiology of the patient, and then either select or reject the patient.
Right. Were there any challenges during the operation or surgery?
Yes, yes. See, the ideal donor is 65 year of age. And as a person grows old, the tissue become little fragile. We need to have little more delicate and generous and very delicate surgery, methodical surgery is needed. Otherwise, you'll have not that much of the results. So we did the surgery with laparoscope, and laparoscopic surgery is giving minimal discomfort to the patient and less pain and good recovery, post-operative recovery. So we did the surgery, donor surgery with the laparoscopic. We harvested the kidney and then we transplanted this kidney to his son. So basically, the idea or message of such type of transplantation is that the age is not only the criteria to accept or reject any kidney, because as a book, as a literature, or as a standard, the 65-year age is the maximum limit where we can have a donor, kidney donor. But in elderly, if all the parameters are good, in the workup the kidneys are healthy, there are many patients who are on dialysis, the CKD patient, end-stage renal disease patients, who cannot undergo transplant because there is an organ deficit. Organ is not there. Family has no eligible donor. So, doing such type of safe surgery give a message to our community and society also that we should not be disheartened if you have no eligible donor or some elderly person is in your family. You come to us, come to the specialist, they will do a thorough evaluation, and only if the donor is safe, because the donor is very important. He is giving or she is giving her health and undergoing the surgery for the benefit of their family member. So they should not be harmed by any means. So after evaluation, we as a team, we do the surgery, we do the transplantation, and we prove that it is safe also, and it is efficacious also, and we can have a good results also. So the message with such type of transplantation, and now this has encouraged also us that now we are taking the elderly donors also, and we have done after that many such transplantation with a very good results.
तो जिन पे आपने सर्जरी जो है वो की है, सन एंड जो मदर है उनकी कंडीशन कैसे है अभी?
देखिए वो कैमरून से आए थे, तो टिल द लास्ट जब तक हम उनके साथ कांटेक्ट में थे दे वर वेरी गुड इन देयर हेल्थ. अभी बिकॉज वी हैव लॉस्ट टच विद द पेशेंट एंड द डोनर, सो वी डोंट नो द करंट स्टेटस बिकॉज फॉरेनर्स बहुत ज़्यादा लंबे टाइम तक ट्रैक नहीं कर पाते हैं उनको. बट टिल द लास्ट मैसेज दैट वी हैड बोथ द donor and the recipient were good, doing good. They were in good health.
आफ्टर सर्जरी उनकी रिकवरी कितनी तेजी से हुई? बहुत तेजी से या इट वाज अ स्लो
It
प्रोसेस?
was a standard recovery, like we discharged the donor on fifth post-operative day. So if we talk about the donor safety, so donor surgery was very much safe. She was recovered well. Her at the time of when they departed from this country, say 15 days after the surgery, she was in a good health, good renal function, and in all the shape she was very good. And recipients was also doing good, and he achieved a normal renal function. That I remember that it was roughly around 1.1 or 1.2 milligram percent, which is a normal renal function. So it was very safe and successful surgery.
वेरी नाइस. एंड जब तक आप उनके टच में थे तब तक उनका क्रेटिनिन लेवल, जीएफआर सब कित
वो बिल्कुल नॉर्मल जैसे किसी भी नॉर्मल डोनर को हम लेते हैं, बिल्कुल ठीक उसी तरह से बिहेव कर रहे थे. एंड द ट्रांसप्लांट वाज अ सक्सेस डिस्पाइट टेकिंग सच एन एल्डरली डोनर. सो इट वाज जस्ट अ नॉर्मल लाइक एनी अदर ट्रांसप्लांटेशन दैट वी डू एट आवर प्लेस. इट वाज जस्ट लाइक दैट.
सो किसी भी तरीके का डाइट में चेंज था, लाइफस्टाइल में आपने चेंज करवाया, ऐसा कुछ?
ये जो यूजुअल मेजर्स होते हैं जो ट्रांसप्लांट पेशेंट्स के लिए रहते हैं, वही सेम उनको भी मैंने बताया. सेम काइंड ऑफ मेडिसिन, सेम काइंड ऑफ इम्यूनोसप्रेशन. थोड़ा ट्विक्स करना होता है डिपेंडिंग ऑन द किडनी फंक्शंस, बट otherwise there was no special care or special kind of precautions that were given either to the donor or the recipient. So it was just like any standard.
Only that during the surgery, we took extra effort and care that surgery goes smooth and the immediate recovery goes as per the standard kidney transplantation. Usually, once the kidney has taken its function, then it's a standard, outcome of any transplant patient. So it doesn't change with aging kidney. Once the kidney has recovered, you have transplanted from one body to the other body. Once it has recovered, then it is recovered. Then there are a lot of other issue like normal course of the any transplanted kidney, doing the basic disease care, diabetes, and it's a standard for any transplantation. But the idea was the immediate outcome. That was very very good.
तो क्या जो पेशेंट है जिनका ट्रांसप्लांट हुआ है वो अपनी पहले की लाइफ जो जैसे चल रही थी उनकी नॉर्मल लाइफ वैसे वो जी सकते हैं? इज इट पॉसिबल?
बिल्कुल. हम यहाँ पर डोनर पे ज़्यादा एम्फेसाइज करेंगे बिकॉज बिकॉज द रिकॉर्ड इज सेट इन द नेम ऑफ द डोनर. सो जो किडनी देने वाली महिला थी, जो मदर थी उनकी, उनका बिफोर ट्रांसप्लांट जो उनके डेली हैबिट्स थे, लाइक सी वॉज अ फार्मर. एंड एज पर हिज ऑन हर ऑन वर्ड्स सी सेड कि सी गोज 3 miles to her fields to before surgery. And after surgery, when she came back for one of the consultations, she said the same thing, that I don't have any limitation of my life. I'm doing the same kind of work that I used to do before the surgery. So that was fantastic. She was a farmer by profession. She used to take care of it. The guy who got the transplant was from the military, and both the mother and son were doing good after the transplant.
Congratulations, sir, and thank you so much.
Thank you, ma'am. Thank you.
Thank you. Thank you.